Hello and welcome to the Eye, your English news bulletin. I'm Akivito and these are the news headlines. In another shocking news, Dimapur police have arrested a 34-year-old married man on Friday at Bank Colony, Dimapur for allegedly raping an 11-year-old minor. Out of the 78 new Council of Ministers inducted into Modi's cabinet, as many as 33 ministers have criminal cases against them. Of these, 24 have serious ones related to murder, attempt to murder and robbery. A report published by Poles Right Group Association for Democratic Reform stated. Many Afghanistan citizens have been disappointed by the new stringent restrictions imposed on the local population in several of the districts that the Taliban have lately conquered despite ongoing talks with the Afghan government and the US Army withdrawal. Meghalaya Chief Minister Conrad Sangma has written to the Chief Ministers of Delhi and Haryana seeking a detailed and proper investigation into the alleged suicide of Samuel Sangma and the death of Rosie Sangma in Gurugram. And now the news in details. The Directorate of Health and Family Welfare Kohima in its press release on the Sputnik V vaccine has notified that to increase the coverage of vaccination against COVID-19, the government of Nagaland has facilitated the procurement of Sputnik V vaccine from Dr. Reddy's Laboratories, Hyderabad. According to the circular issued on June 8 by the Ministry of Health and Family Welfare Government of India, the rate of Sputnik V vaccines with GST 5% per dose costs Rs 995.40 paise, while the private hospitals are charging Rs 150 and over for the vaccine as service charge and for consumables. And the total rate payable for Sputnik V vaccine receivers, the charge per dose would be Rs 1,145. Initially, the 2-dose Sputnik vaccines are being made available in Nagaland for 4,800 persons in private hospitals, Bethesda Hospital Kohima and Faith Hospital Dimapur. It further stated that Sputnik V vaccine can be availed by all beneficiaries above the age of 18 through advanced booking in the CoWIN app. The Sputnik V vaccines will be administered from 12 July and will be offered from Monday to Saturday every week from 10 a.m. to 4 p.m. and the second dose of the vaccine will be due after a gap of 21 days. The process of registration and booking on CoWIN will remain the same as Covishield, and the beneficiary will need to produce a valid ID card and a valid mobile number. In another shocking news, Dimapur police have arrested a 34-year-old married man on Friday at Bank Colony in Dimapur for allegedly raping an 11-year-old minor. Deputy Commissioner of Police, Crime Branch, Relo IA, told HornbillTV that the accused was arrested and was currently in police custody and that investigations are on. The minor's relative informed that it came to their notice that the accused, one Israng, who is said to be the victim's uncle, had been taking the victim to the hospital for treatment as she was bleeding from her private parts. As the condition of the victim was not getting any better, the accused reportedly admitted the victim to a hospital in Dimapur for 2 days. It was during this time that a doctor on inspecting the victim's condition felt suspicious about the injury and reported it to the police, after which the victim's family on Friday decided to file an FIR against Israng and left the investigation for the police to handle. Amidst the COVID-19 lockdown in Nagaland, the high-powered committee of the Nagaland government, after meeting on July 8, announced Unlock 2 with further relaxations from July 11 to 17th. All shops and business establishment, takeaways and home deliveries will be allowed to open from 6 a.m. to 4 p.m. E-commerce establishments are permitted for the same. Movements of vehicle and people are allowed from 4 a.m. to 7 p.m. Beside hosting competitions, outdoor sports activities are allowed with a maximum of 100 people, following strict standard operating procedures. Long-distance trains are now also allowed to stop at the Dimapur railway station, but under the condition that the passengers do not show any COVID-related symptoms or they have a certificate showing that they have received both the doses of the vaccine. The state is yet to allow bus services and inter-district taxi services. The alleged suicide of northeastern youth late Samuel Sangma and the death of Rosie Sangma during the previous month had created a furor, with the news garnering a lot of attention on social media platforms. And now, in relation to the case, there has been another development. Meghalaya Chief Minister Conrad Sangma has now written to the Chief Ministers of Delhi and Haryana seeking a detailed and proper investigation into the matter. When Hornbill TV reporters contacted the family of Samuel Sangma, a family member informed the news channel that the Meghalaya Chief Minister was explained about the matter after a memorandum was submitted to him, to which the Meghalaya Chief Minister asked the family of the deceased to file an FIR after the family has received the post-mortem report. On this matter, the Chief Minister assured of providing assistance. The family informed Hornbill TV further that they are expecting the post-mortem report today, the 10th of July, and that the family would be filing the FIR in Gurugram. Only after receiving the post-mortem report will they know which day they will be filing the FIR, which will likely be on Monday. They said late Samuel Sangma's family further assured that they would keep updating Hornbill TV about any new developments in the case. Prime Minister Narendra Modi is scheduled to chair a meeting with the Council of Ministers on Wednesday, July 14th, said sources. This will be PM Modi's second meeting with the Council of Ministers after the Union Cabinet reshuffle on July 7. A day after the expansion of the Union Cabinet, the Prime Minister had back-to-back meetings with the Union Cabinet and Council of Ministers on Thursday. In the meeting on Thursday, sources said that the Prime Minister had cautioned ministers against any complacency in the fight against COVID-19, saying that over the past few days, there have been pictures and videos of crowded places and people roaming about without masks or social distancing, and it should instill a sense of fear in us. The sources said the Prime Minister noted that people not following COVID-19 protocols was not a pleasant sight. Stepping up efforts towards population stabilization, the Yogi Adityanath-led Uttar Pradesh government is all set to issue a new population policy 2021-2030 on the occasion of World Population Day on July 11.
Through the proposed policy, efforts will be made to increase the accessibility of contraceptive measures issued under the Family Planning Program and provide a proper system for safe abortion, while on the other hand, to improve health facilities, efforts will be made for population stabilization by providing accessible solutions to impotence, infertility and reducing the newborns and maternal mortality rate. Chief Minister Adityanath will be releasing the new population policy 2021-30 on July 11. The State Law Commission has also prepared the draft of the Uttar Pradesh Population Control, Stabilization and Welfare Bill 2021, on which the public can give suggestions till July 19. In the new policy, a target has been set to bring the birth rate to 2.1 per thousand population by 2026 and to 1.9 by 2030. One of the key points in the new policy is to make comprehensive arrangements for the care of the elderly, apart from better management of education, health and nutrition of adolescents between 11 to 19 years. The period of population policy 2000 to 2016 of Uttar Pradesh has ended, and now a new policy is the need of the hour. The new policy has an innovative proposal to set up health clubs in schools with the awareness efforts for population stabilization, as well as a system for digital tracking of newborns, adolescents, and elderly people in line with the spirit of the Digital Health Mission.
Warning that new kinds of coronavirus strains may be seen in the future as mutation is normal for viruses, Dr. Matthew Varghese, public health expert and former director, St. Stephen's Hospital, New Delhi, cautioned people that they need to be careful and follow COVID-appropriate behavior.
Is normal for viruses and they will keep mutating as long as their viruses are multiplying, and that is the norm, the expert said. One should be prepared for various types of mutants to be present in the environment in the future, and therefore we have to be careful and keep following COVID-appropriate behavior, the health expert said. Dr. Varghese also said that the population in the country has not been immunized to the same level as compared to the US or the UK. The people need to be careful, particularly in areas that are crowded and closed, he added. Dr. Varghese also recommended that wearing masks, hand washing and social distancing should be followed even while visiting tourist places. Don't touch the mask, and if it is touched, then it should be sanitized, Dr. Varghese said. The mask is a person's essential shield, covering both his nose and mouth, the expert said. When sanitizing, cover the entire hand and fingers, and in the case there is no sanitizer, one should carry a soap and wash the hands, the health expert said. The mask should be worn all the time while interacting with others, said Dr. Varghese.
US President Joe Biden has warned Russia of consequences for the ransomware attacks emanating from the country, underscoring the need for Moscow to take action against groups engaged in the crime.
Biden spoke with Russian President Vladimir Putin on Friday about the ongoing ransomware attacks by criminals based in Russia that have impacted the US and other countries around the world, the White House said in a readout of the call. Yes, Biden told reporters at the White House hours after his call with Putin on this issue when asked if there would be consequences to the ransomware attack. During the call, the White House said Biden underscored the need for Russia to take action to disrupt ransomware groups operating in Russia and emphasized that he is committed to continued engagement on the broader threat posed by ransomware. I made it very clear to him that the United States expects when a ransomware operation is coming from his soil, even though it's not sponsored by the state, we expect them to act if we give them enough information to act on who that is, he said. During the call, Biden reiterated that the United States will take any necessary action to defend its people and its critical infrastructure in the face of this continuing challenge.
Prime Minister Narendra Modi on Wednesday hit the reset button to bring in 36 new faces in his Council of Ministers, taking the tally to 78, just a notch short of the statutory limit of 81. Of these 78, however, as many as 33 ministers, 42% have criminal cases against them.
78 Council of Ministers, as many as 33 ministers, 42% have criminal cases against them. Of these, 24 have serious ones related to murder, attempt to murder and robbery. A report published by Bold Rights Groups Association for Democratic Reforms stated. ADR cited election affidavits to highlight the cases against the ministers. Also, in its analysis, ADR found that around 90% members of the new Union Cabinet, 70 ministers are millionaires, meaning that they have declared total assets amounting to over Rs 1 crore. 4 ministers, Jyotiraditya Scindia has over 379 crore, Piyush Goyal has over Rs 95 crore, Narayan Rane has over Rs 87 crore, and Rajiv Chandrasekhar has over Rs 64 crore, which have been categorized as high asset ministers, which means that they have declared assets worth more than Rs 50 crore. The proportion of union ministers who have declared criminal cases against them has risen by 3% points after the expansion. Analysis by ADR in 2019, when the first cabinet was sworn in, showed that 39% of the 56 ministers, 10 had declared criminal cases against themselves. In that cabinet too, an overwhelming majority, 91%, were crore-patis.
Days after Haitian President Jovenel Moïse was assassinated at his official residence, at least 2 Haitian Americans and 15 Colombians have been arrested by the Haiti police. Addressing a presser, Haiti National Police Director Leon Charles said that at least 28 suspects may be involved in the murder of the Haitian president, including 26 Colombians and 2 Haitian Americans. 8 other people have fled and 3 assassins were killed in the shootings with security forces, added the official. Moïse was shot dead on Wednesday at his residence during an early morning raid by a group of gunmen. He had been ruling Haiti by a decree after legislative elections due in 2018 were delayed. Disputes have been around on when his term ends. Haiti's constitutional referendum, which should have taken place in April but was postponed due to the COVID-19 pandemic, will be held on September 26. The National Electoral Commission announced on June 28. A study conducted by a Delhi hospital has suggested more than 80% reduction in both outpatient attendance and surgical work compared to the year before.
The cohort study conducted by a team at the Indraprastha Apollo Hospital in Delhi and published in the Indian Journal of Medical Sciences observed nearly 600,000 cases, including a thorough observation on the impact of the COVID-19 pandemic on various medical and surgical specialties for the entire duration since the onset of the pandemic, and compared it with the preceding pre-pandemic period, June 1, 2019 to March 31, 2020. The study, titled Severe Impact of COVID-19 Pandemic on Non-COVID Patient Care and Health Delivery, an observational study from a large multi-specialty hospital of India, also revealed that new and follow-up cases dropped by 57.65% in the COVID-19 year. Outpatient cases attendance dropped by 89% and surgical work dropped by 80%. The study evaluated the data of 6,77,237 cases, 5,99,281 outpatient and 77,956 hospital admissions in the past 2 years, pandemic and pre-pandemic. It found that there was a significant effect of the COVID-19 pandemic on most spheres of clinical practice, including outpatient attendance and elective surgeries. Attendance of both new and follow-up cases dropped by 57.65%, P. Shivakumar, Managing Director of Indraprastha Apollo Hospital said. As per the Medical Director, Apollo Hospitals Group and Surgeon Consultant, Pediatric Gastroenterology, Indraprastha Apollo Hospitals Dr. Anupam Sibal, the COVID-19 pandemic has had a significant impact on both the hospital's major medical and surgical specialties.
And this was all for the eye. For more news and the latest updates, stay tuned to Hornbill TV.